Good afternoon, everybody. Welcome to this Reuse Community of Practice webinar. I'm Marty Exline with the AT3 Center, and we're excited about today's webinar on the topic of cleaning and disinfecting during the COVID-19 pandemic. And this is a topic that we've all obviously had a continued interest in. We've had some past webinars and some past information on the topic, but there's still a lot of interest, obviously, in infection prevention and on these issues, and guidance and information changes as does our circumstances in terms of COVID from time to time. So it's important to the state and territory assistive technology programs and how they deliver their services. We are seeing many states and communities that are loosening their COVID rules lately. So it's certainly more important than ever to make sure that we're all doing everything we can to deliver quality and safe programs. Go ahead and move to the next slide. And our presenters today, we're very, very lucky to have our partners, Carolyn Phillips, with the director of the Georgia Tools for Life and Services and Education, and of the Center for Inclusive Design and Innovation, and Liz Persod, the Program and Outreach Director for the Tools of Life program. So we greatly appreciate them providing the presentation for us today. And go to the next slide. So if you do need the captions, just click on the CC button on the control panel. For anybody that has any questions, go ahead and insert them in the chat window, and then we'll answer questions and comments at the conclusion of the panel. And definitely be aware of upcoming events. Check in at the at3center.net events page. We'll also have registration links set out for webinars via the AT3 listserv. And if it's a reuse topic, of course, on the Reuse COP Community of Practice listserv. And then finally, you'll have a post-webinar survey link at the end of the presentation. And so when you receive those, please definitely complete those and send those back. And we especially want to know about what other topics that you'd be interested in us pursuing. And with that, go ahead and move on to the next slide. With that, I'm going to go ahead and introduce you, Carolyn, and let you go ahead and take it from here.
Oh, excellent. Thank you so much, Marty. Really appreciate that. And especially appreciate this continued collaboration that, definitely has been transformational on so many levels. And hello to all of you across the country in the states and territories. We miss y'all. Miss the face-to-face, and are very glad that you're on with us today. This topic is one of those that I, think, oh gosh, we will have exhausted this. Liz and I've talked about it several times, and Trish, and we've been like, oh yes, we have said everything we can say when it comes to sanitization and disinfecting and cleaning, but we do actually have quite a bit of information that we're going to be sharing with you. A lot of new information, kind of what's different, and a whole bunch more. So Liz, let's move to the next slide, and then do you mind just talking with everybody about how important the feedback is, and I'll turn it to you.
Sure. Thanks, Carolyn. Hey, everyone. I hope you are all doing well and staying safe out there. As always, we do want and need your feedback. So at the end of today's webinar, we're going to put up a link, and we'll definitely put that in the chat for you to be able to click on it as well. But it's a very brief survey from AT3, and we just want to know not only how we did, but the other topics that you all want to hear, especially when it comes to the AT Reuse Community of Practice. So again, we need and want your feedback, and we'll be sharing that link at the end of the webinar. And if you could just spend just a few moments and give us your feedback, we would greatly appreciate it. I wanted to go ahead and jump in and share the learning objectives of today's webinar. Just some 3 quick points that we're going to touch on, and then we're going to jump right into the meat of today's discussion. So at the end of today's webinar, you all will be able to identify 3 key factors for preventing the spread of COVID-19 in the workplace. You'll also be able to identify 2 sources of guidance for safe and effective cleaning and disinfection practices. And lastly, you'll be able to describe how to determine the effectiveness of UVC spectrum devices when it comes to sanitization and disinfection. So lots of good information coming up, and I'll go ahead and let Carolyn kick us off.
All right, thank you, Liz. So as many of you know, we have here been at Georgia Tech within our Tools for Life program, been working extremely closely with the Centers for Disease Control and Prevention and also the CDC Foundation, both located here in Atlanta. And so we're going to be sharing quite a bit with you as far as what's new, what's different, and how does it affect our reuse operations when it comes to assistive technology reuse. I would also encourage you to think about it kind of like we have, that this also involves your demonstration and your loans of equipment too. So the guidance that we're going to be talking from obviously is the CDC guidance, and it is all about looking at infection risk mitigation. And that's something that we've been talking about for years, but it is evolving. And we'll move to the next slide. And there's quite a few things when we're talking about what's new and what have we learned as a result of COVID-19, and what are some of the methods of virus transmission. When we met with y'all last and talked about this, we were very confident in what we knew then. What we know now is that this continues to grow. This conversation continues to grow. There is absolutely growing pressure on the CDC to change the description of virus transmission. Really, the significant scientific opinion considers COVID-19 to be airborne, so an airborne virus, versus the current CDC language, which is about droplets. That's important to know on a lot of levels. When you're thinking about how do we need to consider cleaning, how do we need to consider sanitization? As you recall, those are two different things. We'll talk about that a little bit more. But then also, how do you think about, when you get equipment in and all of that, and how you treat it? Airborne, very different than droplets. OSHA has been ordered to update their guidance by March 15th. So that's coming right up. And CDC obviously is getting a lot of pressure, as we said, to make changes first. The primary mode of COVID-19 transmission is inhalation of the virus. So thinking about that, as we're sanitizing, as we're cleaning, it puts even more of thought that we need to put into how people are engaged with equipment, how they're interacting, what do they need to be wearing when it comes to protective equipment, all of those things. The source could be infected persons in the immediate area, or, and it's recently been acknowledged, ventilation systems, when it comes to transporting that virus. This puts emphasis on ventilation systems. At Georgia Tech, within our own building, we actually have a new ventilation system that is, it's high-tech, top of the line, and it is designed specifically to help us when it comes to keeping everybody safe. Effective social distancing and the use of proper masks in the workplace obviously play a big role too. Transmission from contaminated surfaces is also now considered to be less likely, but still possible. And that's important to know. As y'all recall, last time we met, we were talking about some very interesting research of how long COVID-19 would live on a surface, and various surfaces were tested. And honestly, it was up to 3 days, all the way, for some very specific surfaces, some that we find within durable medical equipment quite often. But there have been reported cases of it living up to 17 days. The key point here is how long is it intact, and how long, before it starts to fall apart where it wouldn't make you, exposed to COVID-19. So here's the good news, because we're finding after a lot of tests that it really is less likely to get it from those contaminated surfaces. So we can stop obsessing about wiping down every package, which is good, but just know that this continues to evolve. And we'll move to the next slide. So some of the strategies for prevention, there are some changes here. Just like we were saying, there's new information, there are changes here. The CDC recommends prevention of the spread of infection by, and a lot of you are doing this very well. Number one, social distancing to prevent airborne contact with the virus. Number two, obviously wearing of masks. This is extremely important. I do want to say back to the social distancing, a lot of folks are saying 6 feet. Honestly, it's more than 6 feet. And so just be mindful that that guidance continues to evolve. Wearing a mask, wearing the masks, the new information here is increased emphasis on the quality of the masks. So as you are sanitizing, as you are getting that equipment in your reuse programs, it's very important that the investment goes into those masks. So the CDC now recommends 2 or more layers of washable, breathable fabric. My family, when we're out and about, which is not very often, we are wearing 2 masks. We're absolutely following, that recommendation. New option, and where it's not necessarily the CDC recommendation, we are going ahead and letting you know that. And all of our references, definitely in links to everything that we're saying is on each slide. But if you have any questions, let us know. But the new option that's not CDC is use commercially produced masks. So that could be the KN95 masks. They're readily available now. And not reserved just for healthcare workers. Matter of fact, we are seeing those within a lot of the reuse programs. So keep that in mind. I am often wearing a KN95 mask underneath my other masks. So diligent use of hand hygiene, washing hands, keeping our hands away from our face, not shaking hands, all of those things, and having hand sanitization kind of equipment, hand sanitizer around everywhere. And so that's the other thing. Some of you have sent pictures of how you have updated your processes, and it's great to see all the hand sanitizer everywhere. And I obviously, absolutely, that's another one of those things that we have to pay attention to. Cleaning and disinfecting of contaminated surfaces, but, and this is new, deemed less likely a source of infection. Self-quarantine when appropriate, very important. I know a lot of our programs, reuse programs around the country, some have continued to operate, which is awesome, but they are going through cycles of where somebody might have symptoms. As soon as somebody might even almost be sick, I'm going ahead and self-quarantining. And then, of course, vaccinations, new, right? Available and or coming. I am getting my first one on Friday. And that's because Georgia Tech's rules allow for that. And I hope all of you are getting your vaccinations. This is because I fall under the caregiver rule here at Georgia Tech. So all of those things have changed since last we talked about this important topic. We'll move to the next slide. So when we're talking also about those newly recommended protective measures, ventilation strategies, as we said, key. February 9th in 2021, just a few weeks ago, this is when the CDC suggested these options for improved ventilation. So it's not necessarily that you have to get a whole brand new big system. It could be how you carry out the activities. Increased outdoor air circulation. I've been on site with a lot of your programs, and so a lot of you do have, access to outdoors. A lot of you have windows that you can open, things like that. Setting an HVAC fan to on and leaving it there for increased fresh air circulation, getting that fresh air in, running that bathroom exhaust fan and the kitchen vent fan continuously, and allowing that outdoor air in through doors and windows when practical. A lot of us do this anyway, which is great, but it's now more important than ever. Consider those portable high efficiency particulate air, so HEPA, HEPA. Some of, I think, folks around the country, some people say HEPA, what have you. Fan filtration systems to help enhance that air cleaning, especially in high risk areas. And so I have seen that in some of the photos that y'all have sent, where you're actually, putting those right next to where people are working. So it kind of becomes a personal, if you will, system to help, which is great. We've seen this also in various other environments where, these are positioned strategically. So consider also using that UV ultraviolet germicidal irradiation, UVGI is what that's the acronym for that, to help inactivate SARS-CoV-2, especially if options for increasing room ventilation are limited. And we're definitely going to be talking to you in much more detail about those UV lights. So you also want to check out the upper room of those systems. And we're definitely excited to share some of the newest when it comes to all of that information. So we will move to the next, and I'm going to turn this right back over to Liz. Liz, take it away.
Thank you, Carolyn. So when it comes to maintaining a healthy workplace, we just have a couple of helpful tips that we wanted to share with all of you. I have a feeling that all of you probably have all these things in place. We just wanted to reiterate, especially as we as AT programs are working on reopening or just continuing with these new ways of living and keeping ourselves healthy and safe. So considering factors that impact reuse operations, we really need to take a step back and just think about our day-to-day living now and our operations and what's happening in the community and how does that impact our everyday operations within our program. So just thinking about the factors that impact timelines and the ability to resume or continue, quote unquote, our normal everyday operations. And some of these can include the status of any existing stay-at-home orders in the state that you're operating. So thinking about your community, your state, what are the actual stay-at-home orders of your state, and how does that coincide with the community coming into your center, reaching out for equipment and what have you. The severity and volume of COVID-19 cases within your community. That's also very important to pay attention to. I think we're all probably very connected to that. Just looking at our local communities, our states, our regions, and just looking at what the COVID-19 cases look like versus other parts of the country as well. And so those are all things I think we all believe are very important to pay attention to as we are just moving along with our reuse operations. Another factor to consider is the ability to enforce proper social distancing within the physical location. Carolyn was just mentioning social distancing. We all know it is 6 feet, but really and truly, it's a bit further than that. And so is your operation, your physical location, really small? How's your waiting room? Are there spaces that people can wait but still be safe and healthy with proper social distancing guidelines intact? Does it mean that you need to have people wait outside in their vehicle and have some sort of text messaging system or some way of communication? And so just again, thinking of all those things. And then of course, the level of contact workers will have with other workers or with customers. So again, just that social distancing, not only for customers coming in, but our teams that we're supporting every day, making sure that they continue to stay safe as we are continuing our reuse operations. So we need to get that plan going to optimize worker safety. Plans for reopening or continuing operations should address preparedness, response, and control strategies. And these are all looking at things that are very specific to the workplace, the nature of jobs, the environment, looking at identifying those areas and job tasks with potential exposure to the virus, and then include control measures to eliminate or reduce exposures. So really just taking that walk about your center, looking at your layout, looking at what it looks like, maybe doing just a mock setup, you know, having some of your team act as if they're customers, go through the motions of it, make that list. What is very specific to you, to your community, and just again, making sure that we're including all of those ways to control those movements, making sure people are safe, so that way we eliminate or reduce exposure completely. Oh, I love this. Y'all know me. It's all about employing inclusive leadership to plan. This to me speaks about the whole philosophy that we all talk about in our community of nothing about us without us. It's so important to preview those plans for changes to operations with employees. And that includes individuals with disabilities, identifying potential pitfalls or proposed methods of compliance or changes, and just really thinking about and discussing with your teams how that can affect each and every one of your staff, your team members. We encourage folks to meet with individuals with disabilities to ensure that they understand the plans and policies that are needed, as well as the accommodations that are in place. So making sure that not only your resources are accessible, but just taking that time to make sure that everyone understands that these new changes are taking place and what does that actively mean. So it's really going back to employing that inclusive leadership to make those thoughtful plans. And I'm going to let Carolyn talk about the business toolkit from the CDC.
All right. Thank you so much, Liz. And I agree. And so when you're talking about those inclusive plans and flexibility, and that builds right into what we have here with the Resuming Business Toolkit that the CDC produced. Some of that could also be adjusting the hours, right? So, and having people come in shifts. What we're seeing with some of the centers that we've been working with is they'll have, let's say they had 4 people working on their reuse, that they would have 1 person, and then of course socially distance, maybe 2 people, and then just different hours too. So just making sure that we're being as flexible and inclusive as possible. You see that also in this toolkit with when it comes to managing for a healthy workplace. The CDC, when we're thinking about how we actually look through the lens of reuse programs, they recommend, the CDC does recommend, and we say that, it'd be great for the reuse programs to identify a workplace coordinator, right? So somebody who's responsible for those COVID-19 issues and their impact in the workplace, somebody who's got this like as front and center, because it is such a serious thing. If possible, implementing flexible sick leave and supportive policies and practices, as we said, thinking about what are the hours of operation, how, Liz, excellent example of how do we have people coming in, and how do we serve folks? Do we actually take equipment out? Do we have a space where we're putting equipment that somebody can actually pick it up, where we're not actually in the same space together? Is there a room that we could do that kind of thing too? So thinking about how flexible can we be with the folks who are actually working on these important projects, protecting employees at higher risk for severe illness through those supportive policies and practices, and then really communicating supportive workplace policies frequently, clearly, multiple methods, and we're seeing that too. There's been, I think, a renewed interest in making sure, and actually in some ways that we're implementing your universal design for learning practices when it comes to helping everybody understand, the policies and making sure they're everywhere and in multiple formats. So using the CDC Resuming Business Toolkit really can help our reuse programs. Just think about a lot of these things differently as we analyze, plan, and communicate about COVID-19. And we'll move to the next slide. So making that physical workspace safer, what we have found is that it's important that everybody, understands kind of what are some of the big needs. We've talked with folks who are putting together plans for their boards, trying to figure out funding. Some folks have actually been writing some grants or using some of the CARES Act funding for these types of things, especially when it comes to the reuse programs. So building ventilation, as we said, it really can pose a serious risk. Thinking about those filtration solutions. And after a prolonged shutdown, really confirming the safety and functionality of, different systems, including your water system. And then cleaning and disinfecting, taking that much more seriously. And it's not just the equipment. It is now more than ever before when we're talking about our reuse programs, it is the whole environment. It's doorknobs, light switches, it's the workspace, it's the tools, the shared tools, any of that stuff. And then also what we have found is that some folks are even designing where they're putting tools in a different workspace, if you will, so that they're shared tools especially, so that folks can access those without having to interact with each other. So any of these different things, cleaning, disinfecting the workplace in accordance with the CDC guidance is absolutely where we want to be. And we can move to the next slide. So Liz touched on this piece when it comes to social distancing, and I touched on it too. Any of these slides, if you want to grab them and show them, use them as part of your policies and procedures, feel free. If you also want to use some of this when it comes to helping people that you're serving understand why, you're doing things the way you're doing them, feel free. What we have found also, yes, the CDC right now in the guidance, it says 6 feet. They actually are going to be coming out with guidance that says much more than 6 feet. And one helpful exercise is really to use that workflow, that floor plan, and look at and identify different locations that each individual in the typical movement of the work day where they are, and how we can adjust workflows and also people flow. So this is very, very helpful and helps when it comes to figuring out how we're going to utilize space differently. Lots of folks have been having to rearrange, rethink, even change the whole direction that folks are coming into their programs. Using even exit doors sometimes, as a way that somebody enters, and then going just one flow all the way back out through the entrance, or going the other way. So there's not cross traffic, if you will. In spaces where social distancing, physical distancing is impossible, for example, the check-in, check-out locations, it really may be necessary to go ahead and create those protective barriers. I remember when I first got into this field, I was using plexiglass like crazy, and then we didn't really use it much, and now it's back. So you can use the plexiglass, you can, use glass or what have you. It really is a great benefit for the customer and also for your team, for the worker. And then distancing for meetings. A lot of times when we are either meeting with a person that we're helping, a consumer, or meeting as a team, just thinking about how we can accomplish that differently. I have been in meetings where I am on Teams or Zoom or what have you with somebody who is literally in an office right next door to mine, but we are protecting each other by doing that. Also, there's a whole lot of information coming out about how we can and what we can learn from telehealth. Some of the assessments that a lot of you are doing around the country, you know, either AT professionals, ATPs, or occupational therapists, speech language pathologists, and how to do that correct matching of equipment. But maybe it doesn't have to be that physical, you know, interaction that so many of us love and miss, but also that we want to be respectful. So video, I'm finding that video is, when it comes to our reuse programs, a lot of the ways that we need to do that, but sometimes audio can be helpful too. And we will move to the next slide. And this slide, Liz and I often, it grosses both of us out. So I'm going to give it to you, Liz.
Thank you, Carolyn.
You're welcome.
So, many of y'all know me. I'm a power chair user. So every time I see this slide, I'm just like, gross, this is my life. So it's important that we talk about this and know it. So people who use wheelchairs are in a lower position than those who are standing are very vulnerable to airborne virus from sneezing and coughing. Social distancing, especially when you are using a wheelchair or at a lower height, is very important for self-protection. And so there's an image here of somebody sitting in a wheelchair and another person standing in front of them. Looks like they're coughing or sneezing, and you can just see the spray of grossness covering them there. So just wanted to share that visual with you because it is something to think about and something that we should all be very, very mindful of. Also wanted to touch on a few things when it comes to optimizing the workflow for safety. These are all points that we shared just briefly a few moments ago as well. But really, when it comes to creating a space for appropriate social distancing, it really comes down to the team talking together, managers, staff, volunteers, looking at the space, looking at barriers, looking at people traffic, and just discussing that workflow, just like Carolyn and I mentioned. And so that risk analysis, as you're looking at all of this and looking at appropriate social distancing, it should consider the proximity of exposure, how closely and how long people interact with each other in person when performing tasks. So it's not just about sitting or standing at one point and the next person being, 6 to 10 feet away, but really looking at how long and how close they really are when they're doing their everyday tasks to get their work done. The second point to consider is the extent of exposure. How many other people the individual tends to encounter in a typical workday? Are they coming into the program, if it's a staff member in an office, just working online and handling, triaging equipment in and out, just those types of things without so much of a hands-on? Or are they really in there scrubbing down the equipment, wrapping it up, making sure it's in the appropriate places, and how many other folks are doing that as well? So this analysis of worker risk by task and location will help all of us determine which employees are at the greatest risk of exposure to the virus, and then what we can do as far as our next steps to minimize all of that. So use of personal protective equipment or PPE, we all know how important that is. Carolyn just talked a little bit about some of the new guidance talking about double layers of masks, or even wearing 2 masks if you're going out. So all workers and volunteers should have PPE appropriate to their roles, the place of work, and potential exposure. Masks are critical. They're the thing that's helping to prevent transmission of the virus. The current recommendation is a 3-layer fabric mask. And so we have a YouTube video here, which you all will be able to have access to, that just talks a little bit more about those masks and washing them daily and just some of the hygiene steps that we need to take. Also wanted to talk a little bit about gloves. Disposable gloves can be helpful. They may be protective in the workplace and for doing public errands, but it's important to know that gloves can transfer the virus. So just because your hands are covered in gloves doesn't necessarily mean that you're just eliminating the virus or any germs out there. Diligent hand washing, sanitization is the most effective and safest way to keep your hands clean and keep the virus at bay. And here we go, hand washing. I think we've all had a number of songs in our head or our watches set timers, or the Alexa and Google's set timers for us to work on hand hygiene and hand washing protocols. Those are all very important and great tools that you could have just posted up in your washing areas, restrooms, in your places of operation as well. So obviously proper hand hygiene is essential to preventing the spread of the disease through surface contact with bacteria, germs, or other contaminants, especially as folks, are touching their face and, touching other parts of, sensitive areas on their body as well. Indication or frequency in the workplace, it's important. Again, these are all things that can be posted in a bathroom, in the washing area, not just by print, but just other ways of having information up there, whether it's a video, steps, pictures. We're all in this AT world, and so we can become very creative with how we can help communicate these important guidelines and tasks, but making sure that we're letting folks know that before and after having direct contact with individuals, washing their hands after contact with potentially contaminated surfaces, that's AT devices, doorknobs, work surfaces, tools, supply containers, after removing gloves, after using the restroom. And then just soap and water can work as well too. And so we've got some good information here from the CDC on how to do that properly as well. We all know how important it is. I was just talking about, posting signs. It doesn't have to just be print. It can be images. You can have videos that folks watch, but making those communications accessible. Carolyn and I will talk, and we mentioned briefly the work that we're doing with the CDC and the website that we've created on making communications and CDC guidance for COVID-19 accessible. And so we want to make sure that we just keep this moving along with all things that are related to COVID-19, especially when it comes to our staff, our team members in our reuse locations. So making sure that messages are accessible, specifically to individuals with vision disabilities. So making sure that materials are accessible, whether you're emailing it, they're digital, or it's embossed braille, however the individual needs that. Individuals with hearing disabilities, again, using American Sign Language videos or live interpreters, and then low literacy levels, creating messages that are appropriate comprehension levels. And so bringing that language down to the simplified plain language guidelines or even below is very helpful. Again, just all the ways that we can be fully accessible. We do this every day. We live in this world, but it is so important now, especially when we're thinking about our health, our well-being, and our lives. And unfortunately, so much of the research and information out there is saying that folks with disabilities are the ones disproportionately affected by COVID-19. Just new research coming out about individuals living with Down syndrome, especially being affected by this in a negative way. And so anything we can do to make any and all these communications accessible, easy to follow, it's our job, and we should absolutely do that. It's important to look at training, policies, and procedures for changed operations. Document is so important. We do that a lot here at Tools for Life in general, but I think as all of these guidances are changing, it can be confusing to people. Oftentimes I'm checking back at the CDC or other websites and just saying, okay, what's new, what's different? I have aging people in my life I need to help keep healthy. I have friends that are reaching out to me for guidance as well. So what does it look like when we document all of these practices, guidelines, but also in our places that we're operating, our reuse organizations, our centers, just looking at policies and procedures for changed operations. So employees and volunteers absolutely need to know the policies to reduce the spread of COVID-19, and that could cover general hygiene, cleaning, disinfection, using masks, other PPE, social distancing, even the symptoms of COVID, and then what to do if they get sick. And there's just the image over here on the right that just says, yes, we are open, help prevent the spread of COVID-19 and maintain your distance. Please keep 6 feet apart. So it's good to have signs like that up, just showing, yeah, we're open, but we're following guidelines to keep everyone safe, and here they are. So good information there. It's important to think about conducting virtual or in-person health checks using CDC guidance. So just taking it a step further and making sure that your staff and your team members understand just the alternatives that are available there when it comes to our personal health checks. So implement an electronic monitoring system that permits employees to respond to screening questions from home, or folks that just need alternative ways to access that is important. Thinking about providing digital alternatives to response to the in-person screening at work. So what would it look like, if there was a digital form online, if there was an app, if there was some system set up that folks can check in, respond to questions that way. Again, just minimizing that in-person contact and making it easy for folks as well. Obviously, training and assigning employees to screen other employees on arrival. Screening should be positioned in a contained area outside of the main work area. So that's all about coming in to a place of business, looking at symptoms, contact-free thermometers. Even for your staff, you can check for a diagnosis of COVID-19 in the past 10 days. And then you can also ask about close contact with someone who has had the virus during the past 14 days. I think we all, as we're looking for vaccines, or as we, months ago looking at ways to get tested, these are all some of those simple questions on a lot of those online forms that we all run into. And so those are great starting points to have those virtual or in person, but we encourage virtual health checks using the CDC guidance. Carolyn, do you want to talk about the vaccine toolkit?
Yes, I would be happy to. Great information. I'm always learning from you, and I appreciate you going through all of that. One of the things, that we're trying very hard to do is to get the word out about the importance of vaccination, and these toolkits that the CDC has made are very, very helpful. And so anything we can do to, share that information is great. So there's a link here on this, and we'll also make sure that y'all have access to that link where, folks understand how their state plan works and what the priorities are for vaccination. Once again, I know, and I'm so thrilled to see so many of you on, that we're literally from all over the country, states and territories, and all have different state plans. I was thrilled that we were able to, and Liz and I and a bunch of our Tools for Life team and a bunch of our partners around the state of Georgia were advocating to get the priorities changed in Georgia, and sure enough, we were able to do it. Which is great, and get folks with developmental disabilities back to the top of the list. So, be sure you're communicating. If you're part of a large group, you may also be able to schedule workplace vaccinations. Sometimes partnering with others is also helpful. The toolkit really is available to anyone, but staff of service organizations, faith-based communities, organizations, and a lot of our reuse and ATAC programs too. We definitely have been spreading the word. And so as we're getting folks in for to get equipment, we can absolutely give them this information. So the other thing, if we move to the next slide, is as people come to the reuse programs, especially in urban areas, it's definitely true here in Atlanta. We have a lot of folks that either are working within the reuse programs, but also that are picking up equipment. They're commuting, often it could be public transportation or Uber or something like that. And some of the public transportation systems do have limited operations. So when we're thinking about that from the perspective of our workers and employees, teammates, what have you, just considering other alternative methods of transportation, changing those working hours to minimize exposure. Some of y'all, I've heard, you're actually scheduling pickup times for your reuse programs, around allowing, if somebody's coming via public transportation or what have you. And then, of course, telework when feasible for our workers. And we'll move to the next slide. As we leave that part of the conversation, I was thinking, Liz, as you were talking about those health checks, and, one of the things that we continue as we're working to raise awareness about accessibility and the importance of inclusion, it's even those physical things. I was thinking what you were sharing with me the other day about it was a temperature check that's sitting out by itself. I think it was on a pole, and it was just way too high up, so you weren't able to actually take your temperature that way. So having temperature checks that actually you're able to check your temperature if you're rolling up or if you're walking up or what have you. Also helping people with vision related disabilities know where the temperature check is, so not moving it around a lot. I know I've walked up to some of those virtual temperature checks, and not because of my dyslexia, as many of you know, that absolutely affects me. And I'll stand there thinking that it's reading my forehead, but I'm supposed to put my wrist up and I don't realize it. So just once again, making sure that folks are very clear about all of those. The other thing is with those policies and procedures, we actually are creating a training specifically as people start to come back in bigger volumes, and having people sign off on that they do understand about washing hands and wearing masks and all of those things. So as you're thinking about your policies and procedures around cleaning and disinfection strategies, and it's not a bad idea to include some of those as people need to sign off on these too, just to make sure everybody's on the same page. And we can move to the next slide. So our mantra for years within the reuse community, the AT reuse community, has been all about safe, effective, and appropriate. Rob and I've talked about this. Marty and I've talked about it. A lot of you, we've talked about this. So safety is the first promise, right, of the AT reuse mantra. What we're thinking about when it comes to safety from a mechanical and electrical issues is very important. But now we're absolutely talking about safe from infection, infectious contamination. We deliver on this promise by adherence to established healthcare guidance and protocols. It's on us to know what the CDC is recommending, and then also understanding the use of approved disinfectants. And we'll show y'all some of that, how to identify some of that. And then also compliance with bloodborne pathogen standard from OSHA, Occupational Safety and Health Administration. For years, we've advocated for the prevention of infection by proper cleaning and disinfecting, and then also diligent hand hygiene. And what we're finding, obviously, is highly contagious diseases. They require those extra steps. And so we will continue to stay safe, and just know that we're thinking about that even more. Definitely effective and definitely appropriate. And we'll move to the next. So sources of potential infection, absolutely the strategy should be considered for protection from COVID-19 and other infection threats as a standard of practice. Pathogens, that pose potential problems can be divided into these three broad categories. So we're talking about fungi, bacteria, and viruses. So the good thing is when we're sanitizing and we're sanitizing diligently and protecting ourselves from COVID-19, we're also addressing these issues as well. So we'll move to the next. So the importance of infection prevention, it's absolutely heartbreaking that COVID-19 has absolutely had this major severity. I know I've lost almost 41 folks. It's heartbreaking, over 500,000 deaths in just 1 year. And we're still trying to figure out what's that long-term impact. That's been some of the conversation that we've been engaged in with colleagues at the CDC and in other areas. We still know little about the immunity gained and from having the disease and how long the immunity may last from vaccination, or how effective the vaccines will be against new strains of the virus. And so that's where it's important to stay diligent. Best estimates are that we have another year at the very minimum of preventative strategies ahead of us. And I think this is one of those things that within our ATAC community, we have led the way, and we have really moved the conversation forward. And it's great that y'all have been so proactive. So we'll move to the next slide. So the CDC guidelines, once again, when it comes to the source of authoritative guidance, a piece of home medical equipment is a non-critical category, as opposed to surgical instruments that require sterilization under the CDC guidelines. I think sometimes people look at the guidelines and they don't quite know where different things fit within those guidelines, and it's important to be mindful of that piece. That's a good example. That's because the devices should not contact mucous membranes or get used inside the body. DME should not require sterilization. So sterilization, it actually, sometimes people use all of these interchangeably, but that's not the case. But it does need to be clean and disinfected in a process that we call sanitization. So sanitization is the key here. The cleaning and disinfection of a device should be done in a manner that removes the risk of transmission of disease. Once again, just we're referring back to the guidelines for disinfection and sterilization in the healthcare facilities, and then obviously CDC guidance. And we'll move to the next slide. So using standard procedures for cleaning and disinfecting of devices and surfaces is very important. Cleaning involves the physical removal of a contaminant, right, to the degree as much as you can, the degree possible. Disinfecting requires the use of appropriate chemicals. Once again, important distinction. From the OSHA list N, and that's where we grab these chemicals, the list is there to destroy the virus. This list has been updated. That's important, new. Remember, we said there's a lot of new information in this presentation, and expanded with new products that are on the market. We're not going to repeat a lot of the basics of the procedures today. You can refer back to the November 2019 webinar. We want to respect your time, but know that that's got all kinds of back to the basics and quick tips for a framework for cleaning and sanitization. And this is, as I said, AT3 and the ATAC programs were ahead of the game by producing that before COVID-19 was even in our vocabulary. So we'll move to the next. So the OSHA bloodborne pathogen standard, when most devices are handled in the AT reuse programs are not likely to pose problems, but it does depend on the prior conditions of use, and that's got to be considered. So that's why we recommend that you just assume that it has, and this is what the framework we've talked about. Just go ahead and assume that it's got COVID-19, or somebody has, it's been in that bloodborne, it's been exposed, and then work from that framework. We must consider that devices used by persons infected with viral, fungal, bacterial infections may pose a threat to workers and subsequent users if the device is contaminated with live pathogens. The bloodborne pathogen standard applies to all occupational exposures to blood and potentially infectious materials, and the CDC, and the occupational handling of regulated waste. So programs are required to devise a plan. So make sure you do have this plan if potential exposure exists, and you can go to the OSHA website and look up bloodborne to find that. And just have that as part of your procedures. And we'll move to the next. Disinfectants for home use. And this is where we want to make sure, and we actually have an image here that we're pointing specifically to this information. Disinfectants approved for COVID-19 will be on the EPA's list N. New products have been added, as we said, in the course of this pandemic, and the list is organized by chemical name, not by brand. So that can be a challenge for me, definitely, and for a lot of us. Here's a good tip, though. Approved disinfectants actually have EPA registration numbers on their product label. And so we've got a close-up where you can see EPA reg number, and it says 777114, I think is what that said. And then, so just be mindful. And that's one way that you can absolutely tell. And we'll move to the next slide. So as we said, guidance is ever evolving in this area. Liz and I have been like, yay, we finished that whole conversation. Trish, we've done it. But no, it's ever evolving. So it's important to be aware that COVID-19 guidance will continue. New information about COVID-19, so much to learn about the virus and the possible immunity, as we shared, long-term effects. And we just need to be mindful of all of that, the new strains. The new administration just released a comprehensive federal plan to assist states, local governments, businesses, and individuals. So we're going to wait and see how much of the proposed plan is funded, and we may be affected by how it's implemented. We have been reading that and paying attention. So we encourage everybody to stay flexible, and also you can check this out by going to the National Strategy for COVID-19 Response and Pandemic Preparedness. It's on the White House, they're accessible, whitehouse.gov website, and we'll move to the next. So a lot of folks have asked about UV-C for disinfection. So that's the ultraviolet light. This is definitely something to think about and consider. 3 different wavelengths. There's C, B, and A. It is a germicidal, and it can deactivate the DNA of bacteria. The UV technology is a non-chemical approach, and that's important to know too. And we can move to the next slide. So when we're thinking about challenges for using UVC devices for disinfection, several of these do come up. Determining what the device is appropriate determining that the device is appropriate and effective for the task, reaching those crevices, for some of the device with the beam, and then also exposing the surface for the appropriate amount of time. So it's a little tricky. And so that's why it's important that you know when you're using the ultraviolet light and the C range, exactly how to do that. But it is useful, and we'll move to the next. So which UVC devices are appropriate? Unlike the EPA's list N that identifies specific cleaners, that meet those guidelines. We don't have a list for the UVC devices that are appropriate for disinfection. It really comes back to regulatory definitions. There's the pesticidal products, there's which meet registration requirements and indicating that they're effective against the organisms. And when registered, they're on list N. There's also the pesticidal devices, which work by physical means. It could be electricity, light, and mechanics. And they do not contain a substance or mixture or substances that perform the intended pesticidal proposed. And so there's no registration required for those devices. So no list in this case. So how do you choose a UVC product? It is illegal to make false or misleading claims about the effectiveness of the device. So if a manufacturer claims that the device is germicidal, they should have scientific data to support that. I know I have often gone and looked at the research behind these and made decisions based on that. And we'll move to the next. So UV devices for air disinfection, that's very important. Some people have said, oh gosh, I've never heard of that. So upper room and upper air, germicidal ultraviolet irradiation uses special design features mounted on walls or ceilings, and that's really how that works, with that UV energy. Those fixtures disinfect air as it circulates from mechanical ventilation. Since the 1980s, GUV systems have been widely used to control for tuberculosis, for example. And we'll move to the next. So I'm going to turn this right on over to Liz, who's going to talk about our accessible guidance as we wrap up. So Liz, take it away.
Thank you, Carolyn. All right, y'all, this is just the last part, just a few seconds, highlighting the project that Carolyn and I spoke about. So this is the CDC Foundation funded COVID-19 accessible resources for people with disabilities project. And so at Georgia Tech under CIDI, we've created a website. There's a screenshot over on the right-hand side that just shows a snippet of the homepage of our website for this project. Please check it out. The project has developed very significant resources for people with vision, hearing, cognitive disabilities, mobility disabilities. And so here is the website. It's cidi.godtech.edu/COVID. We encourage you all to check it out. Reach out if you have any questions about it, and hopefully we'll be hearing from some of you. And yeah, just really want you all to take advantage of it and definitely help us get it into the hands of folks that need it. That's the whole purpose of the project. And we really want to make sure people are seeing all of these safety guidances and guidelines in accessible ways so they understand it, comprehend it. So what questions do y'all have? And obviously we can, y'all can reach out to us if you have questions or want to continue the conversation.
Yeah, I don't know if you saw Angela did comment when we were talking about HEPA systems, talking about schools and demo centers don't have access to those ventilation options. Just asking about if there were better systems or if you've seen a list of vetted companies.
Yes, thank you, Marty, very much for reading the question, and Angela, thank you for asking. Yes, there are better systems for sure, and definitely can send you some of those resources that we have found. Keep in mind these continue to evolve because they have moved to the front and are in high demand, and the technology continues to evolve. A lot of research wasn't done on these for years, and now we're seeing that there's all kinds of funded research in this area too. So continue what we have right now, but we can send more later. No problem. Happy to help.
We have the survey link here. And so hopefully this has been put in the chat. But please, yeah, we talked about this earlier. Take a few minutes and let us know what you think, not only about the webinar and the content, but just other topics, obviously, that you would like for AT3 to cover. And
I want to thank you both. This has been just extremely valuable. I know that things are opening up and we're all grateful for it, but obviously we have a lot to think about. We have to be vigilant. And I especially like that you did also focus on inclusion, which is something that we all really have to be focused on right now, I think, both in the vaccine process and as we go on in all aspects of our work. So thank you both again. And I want to thank everybody that participated today. And we hope you have just a fantastic day. Thanks.
Thank you, Marty. We appreciate it.
You bet.
Always an honor.
Thank you, Marty. Thank you, everyone.
Thanks, everyone.